Hi, my name's Louise Lamerton and I'm one of the renal dietitians from Sheffield. My job role is to look after all the home therapy patients and their dietary needs, including those on peritoneal dialysis. My average day, as you'll see from the clips, is quite busy and varied. So I may start the day by logging onto my computer and checking all my emails and post for any referrals of patients that may have been made. I may then go to an MDT meeting, which is a multidisciplinary team meeting where we talk about patients' care to make sure that everybody's singing from the same hymn sheet and on the same page. And then maybe do a clinic, which is mainly on the telephone at the moment. That's from post-COVID, where patients have opted to stay on the telephone as they prefer speaking to me in a more relaxed environment because they're generally at home with their feet up. So we might have a chat all afternoon to some patients over the telephone, and then I'd finish any more admin off and then go home for the day. The best part and most exciting part of my job is actually building relationships with the patients, particularly those on home therapies, getting to know them and their families and helping them to live as full and varied life as possible, and most importantly to enjoy all their food that they eat and choose. The hardest part of my job is trying to help those patients that aren't ready to be helped, as we all want them to live life to the full and be as well as they possibly can, and sometimes talking to them about diet is just too difficult for them and they're not ready for the conversation, and that's the hardest part, as you know that you can be of benefit to them. What would I be doing if I wasn't a dietitian? I mean, that's quite a difficult question to answer because I've been doing this job for over 20 years. But I think if I never was a dietitian to begin with, I would love to own a little coffee shop that sold lots of nice little gifts and trinkets somewhere in the countryside or by the seaside. Not quite sure what it would be called, but it would be very quaint with lots of nice things in it. Hope that's been interesting for you. A day in the life of a PD dietitian. That's all for now.